I'm Dr. Mary Ann Bowman. I'm a primary care doc and long-term volunteer with the American Heart Association. We've brought together experts from the writing group that writes the guidelines that we as docs and your healthcare teams use to give you, our patients, the best care possible. I know I've learned a lot, and you will too.
This guideline was an opportunity to be able to robustly review comprehensively all the scientific evidence to help make recommendations on how to best treat atrial fibrillation.
I had the chance to work with a vast writing committee, and this group has vast and diverse expertise. As we work together, we really look at some of the new evidence that have come out and try to translate these in the most practical way into guidance that clinicians and patients can take from and really improve the care of patients with atrial fibrillation.
There are 4 chambers to the heart, and there are 2 upper chambers and 2 lower chambers. When you're in normal rhythm, the upper chambers receive blood back from the body and from the lungs, and then they squeeze and push blood through the valves to the lower chambers, which then squeeze and pump blood out of the heart. So it kind of is like a pump. But what happens in atrial fibrillation is that the upper chamber goes very rapidly. And the other thing that can happen is that the upper chamber isn't squeezing synchronously anymore. So the blood doesn't go through quite as swiftly or as fast. And that puts you at risk for potentially clots forming. And if they break off, they can go to places we don't want them to go, like the brain, and cause a stroke, or the kidneys, etc.
I was initially told that I had AFib on a routine doctor visit. I was kind of overwhelmed by that information because I had heard of AFib, for years, but I didn't know anything about it.
SOS stands for Stroke Optimizing of Risk Factors and Symptoms Management. It's very important that we tackle all these aspects as a comprehensive way to manage atrial fibrillation. Many patients can qualify for anticoagulation or blood thinners to prevent and mitigate the risk of stroke. I must add that in the new guideline, we emphasize the process of shared decision-making. It is important that patients discuss with their doctors the different strategies and options available for managing atrial fibrillation, but those options need to be framed also within patient preferences and goals of care.
In this guideline, we provide a head-to-toe framework to really bring out the message in terms of optimizing risk factors and comorbidities, meaning other health conditions. For this, the head-to-toe stands for H for heart failure, E for exercise, A for arterial hypertension, meaning high blood pressure, D for diabetes, T for tobacco, for smoking cessation, O for obesity, E for ethanol, also alcohol use, S for sleep.
It's really important for you to really try to work on these factors that increase your risk for atrial fibrillation and increase the amount of atrial fibrillation, as well as how it might progress to more advanced forms that like more persistent episodes.
Coffee has never been shown to affect or worsen atrial fibrillation. Many of my patients have experienced when they come talk to me, the first thing they tell me is that they quitted their coffee every morning, something they adore. Please know that there's no need for that.
When you're in atrial fibrillation, we want to make sure that the heart rate is not racing away too fast. The ideal is to get back to the regular heart rhythm. There are medicine and procedures that can help achieve this. Your atrial fibrillation treatment may change over time, which is another reason why annual assessment is important. Your stroke risk is reevaluated every year as your risk can change.
I've always been someone who has been an advocate for myself. I've always advocated to know what's going on with my body.
The guideline emphasizes shared decision-making. It's your body, and you're taking the risks and getting the benefits of all these therapies.
we would encourage the patient to tell your clinicians and your healthcare team about changes in your symptom, in your healthcare condition, as these can impact what strategies may be best at a certain time point.
I believe it's important for us to do the research. I think it's important for us to recognize that there is information out there that can really assist us with our personal health journeys. And I have to say, the American Heart Association provides some amazing resources at heart.org. I can say today that my AFib journey has been really a good journey.
Our goal as physicians is to enrich your life, to make your life better, to help you achieve your goals and help you do the things you love.
You are an important part of the AFib care team. Together, we can achieve the best AFib care for you.
That was a lot of excellent information. Remember what they said, you have more control than you think. So, ask questions, take your meds, keep your healthcare team informed, have regular checkups, and make the lifestyle changes that will help you to feel your best.